Hello everyone, thank you for joining us in our 2021 MAHEC Collaborative Case Competition presentation. We will be taking you through Henry's health journey. Today's presentation is brought to you by Team Needs More Caffeine. Before we begin, we would like to give you a brief introduction. Hi, my name is Alyssa Mendoza. I'm a speech-language pathology student at Rockhurst University.
Hey everyone, my name is Olivia Crabtree. I'm a third-year pharmacy school student at UMKC.
Hello, my name is Lauren Wiggins, and I am a physical therapy student at Rockhurst University.
Hello, my name is Kylie Lembeck, and I'm a medical student at Kansas City University.
What's great healthcare without collaborative effort? Here are some goals that can make Henry's care efficient. Communication. Strong and effective communication is needed not only for Henry, but among the healthcare team. An example of this would be documenting accurately on Henry's electronic medical record. This ties into our second goal, thorough care. Henry's healthcare team can make sure to complete the appropriate screenings, assessments, and evaluations so that he can be treated appropriately and discharged. Lastly, patient-centered care. By putting Henry first, this will allow him to be an active participant in his care. Examples of this are good communication, respect, and asking Henry what are some of his goals.
Let's take a second and meet Henry Williams. Henry is a 69-year-old African-American male from Poplar Bluff, Missouri. He was recently admitted to Poplar Bluff Regional Medical Center for an acute COPD exacerbation. During his stay, Henry expressed concerns about his housing arrangements, self-independence, and worsening health conditions. Mr. Williams is married to his wife, Eartha, and is ready to return home to be by her side. Now, let's dive a little deeper into Henry and his surroundings. Henry is married to Eartha, and they've celebrated 47 years together. Betty is their daughter-in-law, and Ty is her son, Henry's grandson. His community is Poplar Bluff, Missouri. This is a town of about 17,000 people located in the Boot Heel of Missouri, or the most southeastern region of the state. Currently, Henry and Eartha live in a ranch-style duplex. He has been receiving care at Poplar Bluff Regional Medical Center these past few days. Betty has been responsible for driving Henry and Eartha to appointments and errands recently, and although she lives in St. Louis, she still makes the commute to help them out. Henry and Eartha are extremely involved in their local church family volunteering. Eartha engages in a ladies' group, and they both enjoy getting together with their friends to play couples bridge.
Throughout Henry's stay, we have learned a lot about the goals he would like to work towards. Henry's main priority is the care of his loving wife, Eartha. Henry has missed Eartha while being in the hospital and worries about how she is doing without him. Along the same theme is Henry's will to be as independent as possible. Henry would like to continue to provide for himself and be the caregiver for Eartha. Next, after being in the hospital for worsening COPD, Henry is beginning to realize that quitting smoking would be beneficial in helping his disease progression. He states that it is about time to quit, but is overwhelmed by how hard it is to follow through with. Finally, Henry would like to get back to doing the hobbies he enjoys. These include couples bridge with Eartha, woodworking, volunteering and being active in his church community, and spending more time with his family. Now on to Henry's concerns. As mentioned previously, Eartha is Henry's main priority, and her declining health is really worrisome to Henry. Oftentimes, this can make Henry feel anxious and overwhelmed when considering the responsibilities he has. After being in the hospital, Henry has become more nervous about his medical conditions and if the treatments he is getting are helping him enough to remain independent. With the uncertainty of his health, Henry thinks about the burden he may be on his daughter-in-law, Betty, who has to travel to help them at home. Finally, Henry is concerned about the financial costs that may be ahead for him. Rehabilitation therapy, medications, home health assistance, meals, and transportation are all areas that need to be addressed in the coming days.
Henry's health journey began after he started experiencing increased dyspnea, cough, sputum production, and fatigue. After 3 days of increasing symptom severity and little response to his home medications, Henry presented to the emergency room. The hospital team picked up right away that Henry was a very sick patient. Through effective communication, the medical team aimed for every team member to move efficiently but safely to make sure Henry received not only relief of the symptomatology, but also worked to address his underlying conditions. Henry was eventually discharged from the hospital. Henry presented with what appeared to be COPD exacerbation. However, due to the severity of Henry's symptoms, his original differential diagnoses were extensive. Henry's previous diagnosis of COPD put him at risk for a considerably wide range of comorbidities. It was extremely important that Henry's health team do a full workup to fully comprehend the extent of Henry's illness. Communication was crucial to make sure not only that each test was reported and recorded, but also make sure the terminology between healthcare team members was unanimous to limit errors. After determining a full assessment, making sure Henry received all necessary treatment is crucial.
During Henry's hospital stay, he received care from many different health professionals, including nurses, occupational therapists, and physical therapists. With this team of healthcare workers, their common goals were to increase his independence in activities of daily living, such as using the toilet or shower, as well as educating him on oxygen therapies and his medications. The physical and occupational therapists would need to communicate with the nurses on his use of supplemental oxygen and his O2 saturation levels following each therapy session. They would also relay any symptoms he may have had during the session and any concerns he expressed. They all would also communicate about his need for extended therapy and care services, such as pulmonary rehab for his COPD once he is discharged from the hospital.
Continuation of Henry's rehabilitation. The speech-language pathologist had the short-term goal for Henry to eat and speak. The SLP performed screenings and an evaluation to check Henry's oral motor and swallowing skills. It's important for the SLP to work effectively with respiratory therapists, nursing, and dietitians. Respiratory therapists help make sure there aren't any concerns with breathing, speaking, and eating. Nursing can inform the SLP if the patient is eating or not, and the SLP can inform of any dietary restrictions. The dietitian can advise soft foods and thick liquids that meet Henry's dietary needs. As for the long-term goals, the SLP will speak with the case manager to suggest speech and swallow evaluations at the rehabilitation facility.
Addressing Henry's oral health concerns is pivotal to treating his overall health conditions. Currently, Henry's oral health is interfering with his ability to eat his daily needs, which is leading to increased weight loss, exacerbated from his weight loss due to COPD. The first concern to address would be to treat Henry's dental phobia so he is comfortable seeing oral health care providers. Afterwards, it is important not only for Henry to receive a tooth cleaning and treat any dental caries found, but to also address his increased risk for oral candidiasis due to his inhaled steroid use. Refitting Henry's dentures is also critical in order to reach Henry's nutritional diet goals. Finally, setting up recurring dental appointments to make sure Henry continues receiving oral health care is important.
As previously mentioned in Henry's goals of therapy, smoking cessation is an essential part in bettering the outcomes of his pulmonary conditions. Things that Henry can do in his personal environment include removing triggers that normally cue Henry to smoke. This could include physically removing and cleaning all areas where smoking normally occurs and placing reminder notes or objects where cigarettes used to be held. Henry also needs to make physiologic changes to help motivate and keep him from smoking. Examples of this could include reviewing his commitment to quitting and the potential benefits that come along with that, such as being with Eartha longer or having less pulmonary symptoms like shortness of breath and cough. Henry could also join a support group that can keep him socially accountable to his will to quit. Additionally, Henry can also try medication therapy to assist him in quitting. These methods include nicotine replacement therapy, Chantix with a manufacturer coupon, or bupropion. Next, Henry's risk and symptoms he brings forward make him a candidate to screen for geriatric depression and anxiety. With his concerns of being anxious and the large changes in his health conditions, this can be overwhelming for someone to go through. Screening tools such as the Geriatric Depression and Anxiety Scales can provide baseline data to determine if Henry is experiencing these conditions. Here are some ways Henry can use his resources to monitor his mood. Meeting with his church pastor to talk about recent life changes, talking about medication options with his primary care physician, keeping a thoughts journal to monitor his daily feelings, and identify triggers or situations that make Henry upset.
The case manager working with Henry and his family would help collect information on various community resources that might be of use to them. Henry has received care at Poplar Bluff Regional Medical Center, but they also have the Senior Circle program that helps participants pursue active lifestyles, learn about health, and meet others. There are also 7 different home health service agencies that are available options to help care for Henry and Eartha when Betty is not able to help. Since Henry and Eartha need convenient and reliable transportation, there is SMTS Incorporated and non-emergency medical transportation that they will be encouraged to take advantage of. There is affordable long-term housing at the Senior Citizen Center that may be a good option for Henry and Eartha. This center houses a cafeteria where they could get meals on a daily basis, or they could contact a Northside Nutrition Center and receive meals through Meals on Wheels. Each member of Henry's healthcare team made it a priority to keep Henry and his well-being at the center of his treatment throughout his hospital stay and on into the next stage of rehabilitation. The communication between professionals allowed Henry's goals and concerns to be heard and acted on, making sure he received the best quality of care possible. Thank you.